Hello, welcome to another question and answer session. This is physiology portion of MRCS. This is the question: which of the following not classically seen in coning resulting from raised intracranial pressure? So we have to find out which is not related to the coning, and this coning it result from raised intracranial pressure. We know that there is a definitive intracranial pressure. When the pressure increase in a certain level, then clinical feature develop. Here the options are coma, hypertension, unreactive mid-sized pupil, synastic style respiratory efforts, and bradycardia. So first of all, we have to know about the coning and raised intracranial pressure. So first of all, here we can see the cranial cavity is confined by a rigid bony framework, except the infant, because in infant there are two important fontanelle, anterior and posterior fontanelle, and anterior fontanelle is prominent. So in case of children, when intracranial pressure increases, the bulging of anterior fontanelle it compromise the intracranial pressure slightly. But here we can see when there is ICP, that means intracranial or intercerebral pressure, it is accommodated by shifting of the CSF. So when ICP, that means intracranial pressure, increases, then shifting of the CSF occurs from one compartment to another compartment. But here we can see once the CSF shifting has reached its capacity, that means the CSF shifting not possible. In this condition, intracranial pressure will start increasing, and it increases as much as higher. So here we can see the brain autoregulates its blood supply as the ICP, that means intracranial pressure, rises. Systemic circulation pressure also increase to meet up the supply of the blood in the brain. And for this condition, normally what occurs? Hypertension develop. That means the systemic vascular pressure increases to meet up the blood against a high intracranial pressure. So when intracranial pressure increases, for blood supply, the blood pressure of the arterial wall also increase to supply the brain. So first of all, hypertension develop. That means the blood pressure increase in case of intracranial pressure rises or when coning occurs. Then when intracranial pressure rises further, brain will compress. Here this point is important. When intracranial pressure increases, it compresses all the substances of the brain and different centers of the brain: cerebellum, cerebral hemisphere, cerebellum, pons, medulla, midbrain, all the structure are compressed. And for this, here we can see the cranial nerve pulses also seen in advanced case. Compression of the essential centers in the brainstem will occur. Actually, all the brain material are affected by this phenomenon. And when the cardiac center is involved, then bradycardia develops. So we know that the cardiorespiratory center, they are located in the medulla oblongata. So when they are involved, then bradycardia develop, and also synastic breathing develop. That means irregular respiration develop. Here we can see the Cushing triad. Cushing triad develop due to coning or due to increasing the intracranial pressure. They are hypertension, it is the first event, then bradycardia and irregular respiration. Bradycardia and irregular respiration, it occurs due to involvement of the cardiorespiratory center, which is located in the medulla. And hypertension, it is the most important and first event occurs when intracranial pressure increases. In this condition, systemic blood pressure also increases and development of the hypertension occur. And here we can see the Cushing triad again. It is widening of the pulse pressure, respiratory changes, and bradycardia. And this is the clinical sign and symptom of the raised intracranial pressure. Here we can see first of all symptoms: headache, vomiting, impaired mentation, and conscious state. And we can see this symptom: headache due to increased intracranial pressure, the brain material compressed, so it also compress the dura. That means the dura matter, which is the pain sensitive. So when the pressure goes to the durometer, then headache develop. Also vomiting when the cardiorespiratory center or when the vomiting center located in the medulla involve impair mentation and conscious state also. And here we can see the sign. One important sign is the papilledema, which is can be seen by fundoscope. Then poor gaze and sixth nerve pulse. The sixth nerve is the first nerve which usually involve due to increased intracranial pressure due to any cause. Because the sixth cranial nerve, it has a long course, and it is closely related to the cranial bones and impair mentation and conscious state. So finally here we can see it is not hypotension, because when there is coning, that means when their intracranial pressure is increased. Here we can see the raised intracranial pressure or intracranial pressure increase in coning, which is not seen. Usually we can see first of all hypertension develop when there is increased intracranial pressure. In this condition, first of all hypertension develop, not hypotension. Then bradycardia and irregular respiration, and also here we can see the coma may develop in case of final stage and even death. Unreactive in mid-size people, it is also true, because we know that the different type of reflex, light reflex and other reflex, uh, they also be compromised because the pathway goes through the brain. Then sinus tract is style of respiratory effort, it is also true, and bradycardia true, and the hypertension, it is not true regarding the raised intracranial pressure. Thank you all.